right, now look, the lungs are not a little bit messier. The lungs are a lot messier. A couple of things I want you to realize is it does not look anything like this picture right here. This is perfect. This is clean. This is what they should look like. But this is a good dissection here. Real quickly, you're not going to be able to identify the different lobes of the heart. Oh, excuse me, of the lungs. But the right side does have three distinct lobes that three distinct bronchi go to. So you can actually see the different bronchi. This is one of the things we're going to be looking for here today. We have the trachea, we have the carina, which you're going to be locating in a moment. We have the right main stem bronchus that branches into a secondary bronchus here, here, and here to feed the different lobes. You will locate these. And on the left side, we have a left main stem bronchus that divides twice. Now, some anatomy books tell us that these things branch as many as 21 times before they get down here to the alveolar sacs. One thing that's going to be very, very clear to you today as you do these dissections is that the trachea is made of cartilage. It's very tough. It would take a lot to crush it. And an asthma attack does not happen in the trachea. An asthma attack doesn't start right here either. An asthma attack doesn't start in any of these small bronchi. It happens in the tiny bronchioles where you no longer have cartilage. Now, as you're cutting down here in the lung, you're going to find these little tubes, and they're going to feel like little straws. They're going to feel like hard plastic straws. They're not surrounded by muscles. They can't contract. Where the asthma attack begins is down here where the bronchioles, which means little bronchus, become about 1 millimeter in diameter. And to put that in perspective again, how many millimeters are there in 1 inch? 25. 1/25 of an inch is where those bronchioles are now wrapped with muscle, and that's where the bronchospasm begins. In a severe bronchospasm, what happens though? Your patient gets so tight that he starts trapping air. And the way I like to illustrate it to my students is like this. Take a half a breath, hold it, take another half a breath, hold it, take another half a breath, hold it, take another half a breath, hold it, now breathe. Can't breathe. I'm only moving air right here, and I'm getting hypoxia. Is albuterol going to work? Can't get it down there to the muscles. The muscles are way down in there. So if your patient doesn't have breath sounds down here in the periphery, albuterol isn't going to work. What else happens in an asthma attack? Swelling. What happens when mucous membranes become inflamed? They secrete mucus. In a real bad asthma attack, your patient's full of air, his bronchioles are closed, he can't breathe, and his bronchi now are producing heavy mucus, which is drying up. So as you look at this thing today, I want you to look at those tiny bronchioles that are like little straws, and I want you to imagine them full of mucus. You can't move air through a little straw full of mucus. You can't suck a